Why don't seniors play hide and seek with Medicare? Because Medicare might not pay for their lift chair, they'd be stuck hiding behind the couch forever. And now, let us explore 11 practical tips on does Medicare pay for lift chairs for seniors. Tip 1. Understand what Medicare covers. Understanding what exactly Medicare covers is crucial for the elderly who might need a lift chair. Medicare Part B can cover the cost of a lift chair, but there are specific requirements. The device must be treated as durable medical equipment. That means the chairlift must be medically necessary and beneficial for the person's health, such as improvement in a mobility limitation that results from arthritis, Parkinson's disease, or some other degenerative malady. Tip 2. Ask your doctor for documentation. To ensure that your chairlift is funded by Medicare, it is essential to obtain necessary documentation from your doctor, including a prescription stating the medical need for a lift chair. This document is integral for Medicare to pay for the chair because it is proof of the necessity of the lift chair for the patient's health and mobility. Tip 3. Get a detailed written order. Apart from the written prescription from your doctor, Medicare also requires a detailed written order, DWO. This document outlines your specific medical needs, which should include why the equipment is necessary and how it will be beneficial for you. The DWO will also mention the type of lift chair required, the start date of the chair's use, and the doctor's signature. Tip 4. Check the medical reimbursement policy. Medicare does not fully cover the total cost of a lift chair. It only pays for the lift mechanism within the chair, which is usually a fraction of the overall cost. Ensure you check the medical reimbursement policy and know the exact amount that will be reimbursed before buying the chairlift. Tip 5. Choose a Medicare-approved supplier. After understanding Medicare's policy and getting all your documentation ready, it's time to select your chairlift. Medicare, however, will only pay for chairlifts bought from Medicare-approved suppliers. Making sure you choose one of these suppliers guarantees a smoother reimbursement process. Tip 6. Opt for rental. If the lift chair is required for a short term, consider renting instead of buying one. Medicare covers the cost of renting durable medical equipment, including lift chairs. The chair must be rented from a Medicare-approved supplier. Tip 7. Know the different parts of Medicare. There are different parts of Medicare, including Part A, hospital insurance, Part B, medical insurance, and Part D, prescription drug coverage. Lift chairs are covered under Part B as they are considered as durable medical equipment. Tip 8. Purchase of seat lift mechanism. Medicare does not cover the full cost of a lift chair, but covers the seat lift mechanism's cost. Therefore, it's vital to understand this while moving ahead with the purchase. The seat lift mechanism is the part of the chair that assists with standing and sitting. Tip 9. Keep a check on Medicare enrollment. Before applying for reimbursement of a lift chair, confirm your enrollment in Medicare Part B. If you're not enrolled, all costs related to the chairlift will fall on you. Tip 10. Scope out competitive bidding areas. Medicare has established competitive bidding for durable medical equipment in some parts of the country. If you live in one of these areas, you might need to buy your lift chair from certain suppliers to get coverage. Tip 11. Understand maintenance and repair coverage. Medicare will generally cover repairs and maintenance of lift chairs, but you'll likely have to use Medicare-approved suppliers and technicians. Understanding these rules in advance can prevent sudden out-of-pocket costs and ensure the chair remains functional as long as it's needed.